webinar. We're going to get started in just another minute. I'm going to introduce our wonderful, amazing panel. So we know that today is probably an emotional day for a lot of you. We know that your level of stress is probably high, and we're hoping tonight you will get some advice from folks who know exactly how you feel and folks that have been through what you've been through, as well as are always very friendly and very helpful program directors. So I'm going to start by introducing our panel in alphabetical order. So first we have John Andrews, MD. He went to medical school in University of Wisconsin. He is a pediatrician in Chicago, former residency program director for pediatrics. He's a former associate dean for graduate medical education and the designated institutional official. Now he's come over to the AMA. We are so lucky to have him. He is vice president of graduate medical education innovations at the AMA. Next up, we have Lou Edgy, MD, MHPE, FAAFP. He is the Associate Dean for Graduate Medical Education at the University of Cincinnati Medical Center. In her role as Designated Institutional Official, another DIO, she supports 100 residency and fellowship programs across all specialties, as well as program directors, program coordinators, and over 700 trainees. Prior to becoming a DIO, she was a program director for 8 years, and she founded 2 family medicine residencies. Next up is Dr. Dan Lee. He is a neurology resident, currently finishing up his intern year at the University of South Alabama. He completed medical school at the University of South Carolina, Greenville. He's been a part of the AMA all through medical school, and he previously served as vice speaker of the medical student section and currently serves as the chair of the Resident and Fellows Committee on Medical Education. Next is Dr. Tani Malhotra, MD. She is a maternal fetal medicine physician and assistant professor of reproductive biology in Cleveland, Ohio. She graduated summa cum laude from American University of Antigua. She recently completed her term on the board of directors of the Society for Maternal Fetal Medicine. She previously served as chair of the resident and fellow section and currently serves on the IMG section governing council for the AMA. Next up, we have Dr. George Sorosi. He's also an MD. He is the vice chairman for education and surgery residency program director at the University of Florida College of Medicine. He is the Robert H. Hucks MD Professor of Surgery. Dr. Sorosi is a graduate of Harvard Medical School and received surgical training at the University of Michigan Medical Center, where he also completed a 2-year gastrointestinal surgery research fellowship. That's really hard to say. He is former vice chairman of the American College of Surgeons, Association of Program Directors in Surgery, Association of Surgical Educational Residency Prep Curriculum. Welcome, Dr. Sorosi. And then last but not least, we have Dr. Aaron Wolbrook, DO. Dr. Wolbrook is a captain in the U.S. Air Force and is an internal medicine resident at Tripler Army Center in Honolulu, Hawaii. So jealous. He is originally from Texas. He graduated from the University of North Texas Health Science, Texas College of Osteopathic Medicine. During his 4th year in medical school, he didn't match into a prelim, so he went through the SOAP process, and he did his internship year at Hattiesburg in Mississippi. So welcome our panelists. Thank you so much for your time and your expertise that you are about to impart on all of us. So thank you and welcome. First question I'm going to throw out to the residents and to someone who was a fellow a year or so ago. And I'm going to mix up the order each time so that we change it up and keep everybody on their toes. So first, Dr. Malhotra, the first question is for you. Please share your personal story about going through the match, going through SOAP. How did you get to where you are? The folks tonight received, unfortunately, probably bad news. And I just want them to know that they're not alone. They can still be a physician. And if you could share your story of how you got through everything.
Absolutely. So as mentioned, I'm Tani Malhotra. I am now a maternal fetal medicine physician in Cleveland, Ohio. I went to the American University of Antigua, which is a school out of the Caribbean, and I'm a Canadian citizen. So as I've seen lots of folks on the call today are IMGs, I also am a non-US IMG. So just to start off, when I was applying, I was hopeful. Everyone in my school told me, you're going to get in. It's going to be fine. You're going to get into residency. I applied to 140 programs, spending almost $8,000 the first time around on applications alone. And when match day came and I got that email, that dreaded, horrible email that says, you did not match, you qualify for SOAP, my entire life flashed before me. Like, what did I do wrong? Maybe I should have done a rotation this way. Maybe if I wouldn't have done something else, I wonder if I would have canceled something. And it was something I'd worked for my whole life. And you just don't imagine that it would not work out for you the way it's supposed to, the way it does for everybody else. And I grieved, and I applied in the SOAP, and I didn't match through this. I didn't SOAP either. I was a Canadian citizen living in New York at the time, and while my visa was still valid, I literally I was applying to OBGYN. That's what I wanted to do. I didn't want to do anything different. I went and sat in the offices of program directors in New York. I searched them, and I went from one hospital to the other, just sitting there hoping that someone would meet me, someone would see me, just trying to find office hours so I could get an externship, get some FaceTime. Maybe someone will have an opening. Some residencies or some specialties have clearinghouses. So as programs become available or residents leave the program through the year, they will start to list those on their website. I started following those. But eventually I realized it wasn't going to work out for me, and I'm going to apply again the next year. So I did an externship. I made the decision to try and enjoy myself in the time that I did have off. And I reapplied. And what I did differently was I applied to prelim positions this time, which I hadn't the first time around. I applied to a more select number of programs instead of applying to all the possible programs, limiting myself to programs that had previously matched IMGs, or, through the grapevine I'd heard had a higher chance of matching an IMG. Ultimately, I did match. I matched into a prelim program and finished as an OBGYN, finished my intern year as an OBGYN resident. And then because the attrition rate is high in most specialties, I was able to find a second year position in Pennsylvania. I moved there, finished my residency there, and then applied for a fellowship in maternal fetal medicine and matched my top program. Ultimately, I think things worked out exactly how I would never have imagined them to, or never thought I wanted them to. If I could do it over, I would not do it this way, believe me. But at the same time, I think the prelim position, and then subsequently my doing a rotation at a different, doing my residency at a smaller program, gave me the opportunity to explore leadership positions in organized medicine with state and national medical organizations, which I wouldn't have been able to do at a lot of other programs. So although it was absolutely heartbreaking and just life-changing to not match, it taught me humility. It taught me that anything can happen. It taught me how to persevere, and that no matter what happens, I'll still rise from the ashes, and we will make it through one way or another. It may not be the way we planned. It may not be the way we expected it would be, but it will work out. And finally, it taught me that it did not reflect on my medical knowledge or my medical abilities. Part of it was just luck, and I just had to go with the flow.
Great. Thank you so much, Dr. Malhotra, for sharing that. Speaking of things not going as planned, Dr. Lee, can you share with us your match story and how you got to be, you're now a resident. So obviously it ended well, but please tell us your story.
Yeah, for sure. So this is actually, 1 year. So I'm an intern, right? So this happened to me exactly 1 year ago, and I was thinking throughout the day, I'm at this center in South Alabama. There's some people that obviously probably didn't match, and I had all these rush of feelings coming back, and so I apologize if you get a little choked up here, but um, I initially applied for neurosurgery. It's something I always wanted to do. I thought it was the coolest thing you could do in medicine, right? Operate on someone's brain. I knew going in that fourth year of medical school that I was fighting an uphill battle. I was a weaker candidate in terms of neurosurgery, but not overall, right? Weak in neurosurgery is actually probably a pretty good applicant still. But I got all this advice that from my school, you need to be looking at other options. You need to consider a second specialty and apply to that. So I ended up applying neurology as well. My love for the brain just isn't in the surgical aspect, but in the medicine part as well. The unfortunate thing is I was very selective in neurology, and is because I was a little cocky, I guess, right? I was like, oh, it's neurology. Once again, I've like really worked hard, making sure I got a good step score, good grades, and doing all the research. I thought it was a very, very competitive neurology resident, so I only applied to a couple programs within neurology, and I, even chose not to rank a couple programs that I interviewed at, including my home program, which is kind of, unheard of. Um, and so I go through all this process, and I'm like, oh, there's no way I don't match, even if I didn't get neurosurgery. I got a couple programs in neurology, and I should just be a shoe-in. Well, unfortunately, you know, I didn't match to my chagrin, and it was devastating. My friends were all texting me, hey, look, I matched. Where are you going? Where are you going? And like I'm just sitting there in my bedroom, like on the point of like sobbing and crying. But I was lucky enough to have a really good support system at the time. I had a mentor at the medical school, and I also had my fiance at the time there to give me support. We went in. I went through the SOAP. I had to reevaluate, what I was going to do, where I was going to apply. There were only like 8 or 9 neurology spots in the SOAP, and I was lucky enough to get one of those. And so I'm glad I made it down here to South Alabama, and I've continued to be supported here, which I really appreciate. I thought that, I might end up at a program that would take advantage of me at some point, because I was someone who was in the SOAP program. I went through the SOAP, and that's not the case. These programs that also are looking for applicants are great programs and really looking for fantastic residents. And so I guess one of the things I learned is that the SOAP isn't just for, it traditionally we think, oh, SOAP is for people who weren't good applicants. So, I've saw plenty of applicants that were fantastic, and sometimes the match system doesn't work. And I was just, you know, and that humility that Dr. Malhotra was talking about really came back, and now I have a different look on things. And I'm not as overconfident as I once was. So big lesson there for me.
Thank you. And thanks for being so honest as well. I know it's hard. I didn't want you to have to relive last year, but it's going to help someone who is on here tonight. So thank you so much for sharing that with us. Speaking about plans going awry, Dr. Walbrook, can you share with us your match story?
Hi guys, so my name is Aaron Walbrook. So my application story is going to be a little bit unique to the majority of people because I was also applying through the U.S. military match. So the U.S. military match, Air Force, Army, and Navy each have their own separate processes, but I was applying through the Air Force match, and I had been told at some point in the year that there's no way that internal medicine applicants will ever have to go through a SOAP process or anything like that, because historically the Air Force has always had more positions than applicants. Well, my year was the difference on that, and we had more than 60 applicants versus something in the 50s range spots. So in December, I was in, let's see, yeah, this would have been 4th year. So in December, I was informed that I would have to pursue a preliminary year. And as one of my many things that I've always regretted is not applying broadly enough. I didn't apply to any prelim positions before the Air Force match. I had applied to internal medicine positions, but no prelim years. And that was one of the things that the Air Force recommends, is at least applying and getting interviews for 10 prelim positions in case that you go for that, because the Air Force utilizes you in a general medical officer capability if you're to be deployed. So I was awarded a prelim year, and I was told I had to find my own position. Well, I applied in December 20th for positions, which, as y'all are all likely aware, is very late in the application process. Most programs basically said we're already done interviewing candidates for the year. And so whenever match day came around, I already knew that I hadn't matched because I had no interviews going in prior to match day. So I was fortunate in that I already had a mental headspace that I was going into the SOAP that day, which I think helped. And when I went into the room to do the SOAP process at my med school, I remember seeing, one of my best friends didn't match that year either. And I thought he was one of the smartest people in my class. And I had other people in the same situation where it was never oh yeah, that person was always a mess up. No, it was people you would never expect. It was people in the same friend groups. It almost seemed like it had no rhyme or reason to what happened. So I applied. I used 40 of my applications on the first day of the SOAP process and reserved 5 applications for the second day. That way, in case I missed any programs or wasn't competitive enough for a program in the first 40 positions, then I would have availability to apply to other programs. I did not get any calls on that first day. I believe today would have been the first day for people to also apply to the SOAP. And so I just want you to have hope that if you haven't received any calls today, that's okay. There's more calls to happen tomorrow prior to the second round. And there's always a second and third and fourth rounds to go through as well, because these programs will offer matches and they don't always get accepted. So on the second day, I applied to my program, Merit Health Wesley in Hattiesburg, Mississippi. And I received a phone call about an hour later from the program coordinator and program director interviewing me. And I was very fortunate to do a transitional year in Hattiesburg, Mississippi. And I think what I learned from this is to always cover your bases whenever you're applying, but also to have the same humility that they were talking about. And I know that one of my friends was applying OB-GYN and had to switch to family medicine, and he ended up loving his career in family medicine. So the road is certainly not over if you have to change careers, and you are more valuable than just where you go or what you do. You are still going to be a physician, and you're still loved and still a wonderful person. Thank you.
Thanks so much for that. I know that made Dr. Edgy happy that your friend now loves family medicine, and we need family medicine physicians. So that was a win-win as far as I'm concerned. I'm going to now turn to our program directors. I'm going to start with Dr. Andrews first. What is your advice for students and IMGs who are going through the SOAP? It's already been alluded that many of them have probably already applied to a lot of programs today since they got notified today. What's your advice? And then the second part of the question is, how should they approach SOAP differently than when they went through the match and applied their first time around to programs?
Yeah, thanks, Maureen. My colleagues will have their own opinions about this, so my answer won't be the only one. But I would say a couple of things. First of all, I think in applying to the SOAP process, you have to be clear-headed about what you want, because the SOAP process, when it resolves, hopefully favorably with an offer to join a residency program, is a commitment. And I just want to allude to the fact, to the point that Tani made about her journey, and she was focused on training in OB. She knew that that's what she wanted to do, and so her path supported that journey. There may be other people who have there are so many different scenarios, but there may be people have different priorities based upon what they applied in initially and what they might accept training in going forward. You know, I think of Daniel's story and his aspiration to be a neurosurgeon, but his interest in neurology led him to that. And so I think you have to be clear-headed, and I guess not just desperately seek a position, any position, because that could be a recipe for being really unhappy in your training. So I think that's really important. And then the second thing I would say is there are many reasons that people fail to match. And it's worth thinking carefully and clarifying for yourself to the degree that you're able, why perhaps you didn't match. Some people don't match because it's a numbers game. They implied an intensely competitive field, and a third of people aren't going to match in that field, irrespective of their credentials. In some cases, people applied and had a really well understood red flag on their record. I don't know, they failed an exam or a class or something, and the way you might behave or represent that is slightly different. And then for others, those factors are perhaps less obvious. Maybe there was a problem in the way you came across in an interview or something that compromised people's interest in you. But I think if you can be honest with yourself about the reasons that you may have failed to match during the match process, and figure out a way to deal with that openly in your conversations with programs in the SOAP process, as well as being honest with yourself about how to manage your record going forward. I think that would be really helpful. But let me stop there, Maury, because I think that Lou and George will have their own opinions about this as well.
Definitely. That's why it's so great that we have program directors in different specialties. So Dr. Sarosi, you are program director in general surgery. What would be your advice for those future surgeons that are going through SOAP?
So I'll confine my advice to kind of people that are interested in surgical careers, not just general surgery, but some of the more competitive specialties like neurosurgery, ENT, orthopedics, plastic surgery, because I think they're fairly similar. So I think I really want to reiterate what Dr. Andrews said, which is I think really important. I think you got to look really closely at yourself and try and figure out why you didn't get what you wanted. And I think having a really critical look at your application, reaching out to your mentors or actually reaching out to other people is really valuable. And sometimes people weren't super honest with you the first time, and you really need them to say, you know, is it your scores? Is it your grades? Did you get a lot of interviews, but you were sort of just good enough a candidate to get a lot of interviews at really competitive programs, but not a good enough candidate to match at them? And just as an example, so we have 6 categorical residents in our general surgery program. We interview 120 people for those 6 spots. So you could get an interview at our program and not match. It actually happens a lot. We typically fill somewhere in the top 40. So, and that's, I think, very typical of a lot of programs, is that they interview way more people, because especially with the virtual match, now people can interview at a lot more places. I think the second thing that you really have to do is you have to ask yourself, what's going to make me happy, right? Because I think that if you look, and I've had access to the SOAP thing, so there are 3 general surgery positions, there are 2 ENT positions, there are 3 neurosurgery positions in the country, no orthopedic positions in the country. So the odds are, if you're trying to SOAP into one of those programs, that is a really steep hill to climb. And they're likely going to interview or match those people to somebody who applied in a different field, who's changing fields, who has unbelievable scores. And so just be thoughtful about it. And then in the surgery fields, consider SOAPing into a preliminary year of surgery, right? Because I think that what you get to do in a preliminary year, so if you have issues with your test scores or with your grades, you can't change those by reapplying in the match. Those will still be the same the next year. What you can do is work at a training program, be the best intern in that training program, and get a bunch of allies who are going to help you rematch. So we had 6 preliminary interns this year in our program. One is an oral surgeon who was doing a year of training, and 5 people who wanted to go into general surgery. 4 of those 5 people got jobs. You know, I don't know where they're going, but they got jobs, right? And so it can really work for you. And so, you know, think about that. And, or, you know, if you applied in a field and there are other fields that you liked, and there are some fields right now with a lot of open SOAP positions. Emergency medicine has a lot of open SOAP positions right now. And so if you could see yourself being an emergency physician, you know, you can probably get a categorical spot in emergency medicine. And if that would work for you, then do it, right? You know, we all tell ourselves, I've got to be this kind of a doctor, but really what you want to be as a doctor, and you will have an unbelievably satisfying career in some specialty, even if it's not the one you thought you were going to go into. I was going to be a transplant surgeon when I was a fourth-year medical student, and I'm not. And it's fine, right? I've had a wonderful career. So just be flexible.
Wonderful advice. Dr. Edgy, if you could please give us your perspective on our attendees going into SOAP and what should they be keeping in mind as they go through the various rounds?
I like alliteration, so I think of the 3 Ps. Number one, anytime there's any sort of earthquake in your life, personal or professional, first of all, protect your heart. And usually you can do that with facts. So for example, 93% of folks who were in the match last year matched by the end of SOAP week. Okay, so match week. So the facts are really on your side from that standpoint, making it through. Secondly, I do recommend pivoting as well. This is going to be an intense week, so take all the emotion that you have and put it into learning what the rules are, making sure you're connecting with people who can help you through this, your support system, making sure that you're understanding, again, what your real focus is. What do you want to really get out of this week? Write your personal statements. And if you are thinking that, you may have 1 or 2 different specialties that you're thinking about, have an appropriate statement for each one and really have thought about it. I'm a family physician, and family medicine is rocket science. And I really am frustrated when people come in and they come from something that's totally not like anesthesia, for example, when continuity of care and comprehensive medicine and a couple other things are the core of our specialty. People can read through. So make sure you've really, really made a decision that this is something that you want to do. And the last P is to plan. So just really plan ahead. You're pivoting from match week into SOAP week and just change your focus and then plan all the details moving forward. So protect your heart, pivot, and then plan.
I love that. I love the 3 Ps. Dr. Malhotra said that she had something to add to this particular topic. Go ahead.
Yeah, just sort of to tie whatever all 3 of our program director panelists have said, people really can see right through what you're intending to do. My second year applying, I applied to like a handful of internal medicine programs, and they knew right away. They were like, you are not going to do internal medicine. And they told me at the interview. When I got into the prelim position, and this may be a position some of you are in, I matched the prelim position. It made available options for second, like the advanced year. I forget exactly what the terminology is, but like the R2 positions became available. And for OB, there is no R2 positions, but there were only like 7 total match positions available. And for a few years, OB went completely fully matched. So I came to, should I apply for like anesthesiology, or should I apply for an advanced year in something else? And I did apply, and I did get 2 calls. And, when it came to actually accepting it, I had to go with my heart. You just have to know what your path is. And sometimes you have to stick with it, and it comes with grief. And it was, I had to choose the 2 in the bush over the 1 in hand, but the 2 in the bush was so much better. So I just wanted to sort of put that out there as well, that option may become available to you, but stick to that plan that you made for yourself.
Great. Thank you for adding that. I'm going to move on to our next question. I'm going to start. I'll give you the order in advance so you can prepare yourself. I'm going to go with Dr. Walbrook, then Dr. Lee, then Dr. Malhotra. So the question, Dr. Walbrook, what is your advice to students and IMGs who are listening to you right now on how they can move forward if they're feeling really, really defeated, frustrated, stressed out, disappointed? How can they move forward?
I was actually mapping my OB for anti-matched family medicine earlier, and he still has.
We're having a hard time hearing you, so we're going to come back to you.
So I guess 2020.
We're gonna come back to you. Dr. Lee.
Yeah. So the big things that I think about right now in this setting is, a thorough reevaluation of your priorities and kind of, what you want to do as a physician. I think it's been touched on with that last question that was, shot to the program directors. I think there's, multiple different avenues that you can take, some more obvious than others. There's things you don't have to go through the SOAP or participate in the SOAP if you don't want to, right? There's other opportunities. I know I had a friend who did not match ophthalmology. He took a research year. He went up to one of the premier eye research facilities in Philadelphia, I believe, and he ended up matching ophthalmology the next year because he built those connections. He worked really hard to get papers out, and he matched his preferred specialty and didn't do something like take a prelim year, which is also another option, right? I actually had the choice between choosing a medicine prelim year versus the categorical neurology spot when I went through the SOAP. And I took a hard look at it, right? Because I was like, do I really want to commit to neurology, or should I, pursue a prelim year and reevaluate? Do I really want to pursue neurology without getting the experience that in medical school that I did with neurosurgery? But in the end, I decided categorical was the way for me to go. And then I think the least discussed and the least obvious pathway is a non-medicine opportunity. I really don't have a lot of experience, what people do if they don't pursue a clinical position, but I know that they do exist. And if for some reason that, medicine in a clinical setting is not not what you want to do, if you can't have this one opportunity, I know there are non clinical opportunities that you can pursue, and I think you just have to seek those out.
Great, thank you. We're going to try Dr. Walbrook again. How do they move on from the news that they got today?
Sure. So it's hard to move on. I'll be honest. It's definitely a process that you have to willingly go into. And I was fortunate that the next year that after I applied, I was able to match into my chosen specialty of internal medicine, and now I'm applying for fellowship in cardiology. And so I was able to continue down my path that I wanted to do just a year later than I originally wanted to. One of my best friends who didn't match OB and went into family medicine, I think he found the beauty of his specialty whenever he switched over. He always enjoyed family medicine with the continuity of care with obstetrics and following the same patients, and being able to also still do obstetrics as a family medicine provider, I think was a big thing for him. And so just taking it a day at a time and acknowledging that those feelings that you have are warranted. Those feelings that you have are real, and I think you have to acknowledge them and just take each day one step at a time, and things will get better, and there will be more opportunities for you to show who you are and to pursue the career that you love. Because I imagine that we all went into medicine for similar goals of taking care of patients ultimately, and you will still be able to do that one day. And so my SOAP process was 4 years ago, or 3 years ago now for me, approximately. And so I can still remember that day vividly. And it's but one small step on my overall career thus far. But I think that the opportunities that I got for my TY year, the friends I made in that program, more than made up for that one day. And I hope that it will for you as well.
Wonderful advice. Dr. Malhotra.
So there's this week, and then there is the year in case you're in the 7% that don't successfully. So I think for this week, you just like Dr. Adji already said, you got to pivot your energy. Like, you don't really have the time yet to be able to grieve because there's so much going on, and that's totally fine. And if, like Dr. Lee said, this is not your year, like you don't want to SOAP, this is not for you, that's okay too. I think just truly understanding what it is you need for yourself is okay. And it's okay to grieve. Whatever emotions you're feeling, those are totally fine. Whatever it is, those are your emotions, and it's okay to feel them. But once you have spent some time grieving, it's also time to get back out there and do what you need to get what you want. So that means developing a plan. What is it what does your future look like? Having those hard conversations. For me, someone said, hey, your interview, you're telling people you want to do fetal surgery? No, too far into the weeds. It seems like you're not going to be interested in any of the general OBGYN. Nobody wants to deal with that. Just be more basic. I didn't end up doing fetal surgery. I actually have no interest in doing fetal surgery, but just as Dr. Sarosi too said, right, he wanted to be a transplant surgeon, and things change. Allowing people to know that you're acceptable, adaptable, will be helpful. Once you're done grieving, if you have the privilege and the means to be able to enjoy yourself, you will not get time like this off ever again. So it's also okay to enjoy yourself. If you want to go on a vacation, that's great too. Take some time for yourself, take some time with your family. Research positions that'll help add to your CV will provide you, if that is what you want to do. If you're just doing it to fill time, people will see right through it. If you can get clinical externships, that might be something that helps as well. What I will typically recommend is the specialty that you're interested in will usually have an annual meeting between now and next year's where the application is open. If you're able to go and attend those meetings, go and meet program directors where they're setting up their tables, their programs, meet with them, tell them who you are. This may be one way, and I know we're going to a more holistic way of looking and reviewing an application. So, this was advice from 10 years ago, but it may help to just go there, meet people, see what programs are about, introduce yourself, hand out your cards. It's embarrassing, it's awkward, but what's the alternative? The alternative of not doing anything is still going to be a no. So at least this way you can get out there if you have the means and the ability to go to these meetings. And then you can also try and do things that will help you, especially if you're an IMG, to try and get some US letters of recommendation. If someone in the chat asked about step 3, our program director panelists will be able to answer this better. I took my step 3. To me, it felt like I was less of a risk to the program. Like, hey, look, I've demonstrated that I can pass all my exams. I've also done my exams, so I don't have to take time off during the program to be able to have time to take the exams. So it certainly helps in those ways. But anything that can help you improve your application if you feel like there was something that was lacking.
Great, thank you. I'm going to move on to our next question for the program directors. And again, if anybody else wants to jump in on the topic, please do so. Just let me know. So for the program directors, I'm going to start with Dr. Edgy first, then Dr. Sarosi, then Dr. Andrews. That's going to be the order. What are you looking for in an applicant who didn't match in the main match and now they're in SOAP? What would make an applicant stand out to you? So if you had some positions in the SOAP, what would make you pause and take a look at that person?
Number one, I sort of slightly mentioned it before, but somebody who's genuinely interested in family medicine and who has sort of demonstrated that is not just saying it as they're sitting here in front of me. I want to understand that they like the continuity of experience with patients. I'll want to know that they like the comprehensiveness of the care that we have. Family medicine is a 3-year program, and what we don't want to do is to have somebody transfer right after their first year. That leaves the program in a bit of a mess and so forth. So that's one of the main things. And then the second thing is really just the fact that they've been thoughtful about what they've gone through. I think some of the most resilient applicants are ones who've come through SOAP. Really some of the most amazing physicians that I've met have a history where they've gone through just so much challenge, and they're empathetic. They are great mentors. They're phenomenal people, and usually just compassionate with patients as well. So there's so many different things that are very positive in that space. We also do know that scores, for what they are worth, scores actually, and this is from literature across all specialties, including neurosurgery, actually don't correlate with an excellent physician as far as the clinical practice is concerned. So that's something to consider down the line.
Thank you, Dr. Sarosi.
So my advice will probably be a little more focused to people who are thinking about preliminary positions, because that's where sort of my expertise is, right? We've never had to SOAP for one of our categorical positions, so I can't actually address that with any expertise. But I think the first thing that I would say as you're thinking about it, so I think you have to think about the SOAP application differently, right? If you do choose to change fields, which many people do because there just aren't really a lot of options in some fields when you look at the SOAP, you have to convince people that it's legitimate. I think as a program director, when we start to look at applicants, nobody's long-term goal is to be a one-year preliminary resident, right? You didn't go to medical school for that. It's just a bridge, right? And so one of the things that I'm going to look at when I look at your application is, can I place you? Because my ability to recruit great people into a preliminary program is going to be based on my ability to take them out the other end and help them get what they want. And so I'm going to want to see that you understand, what the strengths and weaknesses are of your application, and that you have a realistic plan to try and address some of those, right? I think the people are like, I have no idea why it didn't match, my application's perfect. I have zero interest in those folks, right? So if you're thinking that's a good strategy and that your dedication to the profession is going to convince people to take you, everybody's dedicated to the profession and has a passion for it, right? The match and the SOAP, it's a little bit of a game. And so demonstrating that you understand the game nature of it, I think really helps you move forward. It's all about realism. I think I just wanted to address, it is natural to be devastated afterwards. And I've actually talked to a lot of people on the first day of the SOAP who are still stunned, right? They can't believe they're here. They don't understand, and they can't move past it. And honestly, I typically move past those applicants because if they can't sort of shift, it makes me worry that they're going to really struggle when they get into a field. And so, my advice to you is it's going to be the hardest thing that you do tomorrow. But when you talk to a program director tomorrow, if you're devastated, you probably shouldn't take those calls, honestly, because they're going to talk to you and they're going to check you off their list. And so really, be prepared. And then I think the one other piece of advice I would give people in the SOAP, so when you're applying in the main match, you're trying to find the perfect program, the perfect fit for you. I think the SOAP is a little bit less about perfection. The SOAP is about finding a program that's going to work for you. It may not be perfect, but if you're given a viable offer in the first round, even though it's not the perfect offer, for by God's sake, take that offer. Because one of the things that I think people aren't clear about the SOAP, if a program makes you an offer and you refuse it in the first round of the SOAP, you are dead to that program. They can never make you another offer, right? And so if you get an offer from a program that you think is good enough, take it. By all means, take it in the first round and get out, because the SOAP is very pyramidal. And so there's a lot of jobs in the first round and most of them fill. And if in the second and the third round of the SOAP, there's not that many opportunities and a lot of people chasing them. So, my advice about the SOAP is you get an offer that's acceptable, just take it, because you'll be happy. They're committed to you. They won't make you an offer if they don't think you're going to work for them. And they're going to be committed to helping you succeed.
Dr. Andrews.
Yeah, I want to pick up where George left off and just reemphasize that the SOAP process is not about finding the perfect program, but it's about finding a pathway. And it's a pathway forward. It needs to be a pathway that leads somewhere you want to go, but it's a pathway nonetheless. And so to imagine that there's a perfect outcome to the SOAP, or that you'll somehow recreate the excitement you had about the programs you applied to in the main residency match, that's unrealistic. So you have to get your head around that and recognize that it's a way forward. It's not about finding the perfect program. I think both Lou and Tani mentioned the fact that program directors and others have radar for genuine interest, and that I can't emphasize enough how important that is. I was in the position one year of filling an unfilled pediatrics spot, and had people who failed to match in urology coming saying they wanted to be pediatricians, and I had to understand whether that interest in being a pediatrician was genuine, or whether this was just an opportunity for them to ensure that they had a place to train for a year before they went somewhere else. And those are the kinds of questions I was asking applicants, ways of ferreting out their genuine interest in being a part of my training program. So that's really important. And then I forget who mentioned it. I think it might have been George, but the idea that you have to take care of yourself first, and if you're trying to demonstrate to a program director that you are going to not only withstand the rigors of training in their program, but thrive in that environment, appearing sad or coming apart or desperate, even though that may be the way you feel on the day that you learn you haven't matched, conveying that sentiment in an interview or in an opportunity to pursue a position is not going to get you where you want to go, because the last thing a program director wants to do is to take what they perceive to be a risk on someone who seems like they might be fragile in their approach to the training program. That sounds harsh, but everybody understands that the demands of residency training are high. And a part of selecting applicants is understanding who's going to cope with those pressures and thrive in that environment.
No, I'm sure everybody appreciates your honesty about that. And yes, it probably is going to be very hard to not be very emotional, but do whatever you need to do to pull it together. When you have these interviews and when you're talking with program directors, just figure out a way to pull yourself together. Maybe it's a song you listen to, maybe it's the Wonder Woman pose, but just get yourself together and then you can break down after, because that's totally normal.
And Lou mentioned the resilience in people who go through the SOAP process as being a real strength, but you need to demonstrate that. You need to show that you're resilient in the face of this terribly disappointing news you've received, and you're going to move forward in a positive fashion.
That is great. So I'm moving on to the residents. We've got 2 more questions before we go to your Q&A. Again, I know that people are putting questions in chat. That is not the place for your questions. Your place for your questions is the Q&A button, not the chat button. We will not be taking questions from the chat. We'll be taking them from Q&A. So for my next question, I'm going to go Dr. Lee, Dr. Malhotra, and then Dr. Walbrook in that order. What do you wish you did differently? Some of you touched on it along the way, but if you could just repeat that. What would have helped you? What resources did you use?
Yeah. So I think it's pretty obvious when you heard my story, what one thing I regret was, and that wasn't ranking all of the programs that I interviewed at. And I think it is a common mistake. And I would have, when I soaked, I received, information at that time, like, we ranked you very highly at my home program. We thought you would match. And I had to tell one of the deans to the face, I didn't rank the program, and that's why I didn't match there. So it was a really tough conversation to have, because they just, they look at you and you're like, man, you just made a boneheaded mistake. So I think that, and if you go through the match again, rank every single program. If the only reason you would not rank a program is if you would prefer not being a doctor that year. And people told me that, and I still just avoided. I didn't listen to them. I was like, oh, no, I'll match. And that's that cockiness coming out. But I think in terms of the resources that I used during the match, I used Reddit, which is a very interesting resource. They have these spreadsheets now on Reddit that talk about programs, everyone that interviews there. It's very detailed about things people liked, what they didn't like, who gave swag, who didn't. It was a really interesting resource. And I actually, for neurosurgery, I applied to every single program because that's just how the match is. But when I applied to neurology programs, I really used that sheet to hone in on which programs I thought I would fit best at. And then there's also other great resources, such as Frida, which is by the AMA, and it has a lot of information as well that you can use. In terms of, what was the last question? I think that was it. Yeah. So
was there anything you wish you had? Was there a resource you wish existed when you're going through this?
No, I think I had all the information to make the decisions that needed to be made with what's available. I just didn't utilize the recommendations provided by many people to me.
That's very honest of you to admit that.
Yeah.
So Dr. Malhotra, before we get to you, let me clearly something triggered Dr. Andrews to raise his hand. So I'm going to let him go so he doesn't lose that train of thought.
Yeah,
or maybe
no,
maybe I'm projecting, but
no,
go ahead.
I just wanted to offer one piece of qualified advice in reaction to what Daniel said, because he said he regretted that he didn't rank absolutely every program at which he interviewed. And I realize this is a little speculative now in retrospect, given the situation that many of the people on the call find themselves in today. But my advice to people applying through the match is not to simply rank every program where you have an interview, because you might match there. And if you match, you have to go and work at that institution. And if there's a program at which you interview where you know you wouldn't be happy training, it's probably better not to match than to end up there for a 3 to 5 year residency. So I think I would qualify that a little bit and say that you have to be confident that you'd be satisfied in the training program if you put it on your rank list, because you could end up there.
Mhm.
Dr. Malhotra, what do you wish you did differently? What resources do you wish you had? And what resources did you actually use?
Yeah, things I wish I did differently. The first year I didn't apply to, just as Dr. Lead mentioned, I was cocky and I was graduating at the top of my class. I had high scores. I had good letters of recommendation, or so they told me. I had never seen them. I didn't apply to any prelim positions because I thought I could do better than that. And I wish I'd applied to prelim positions my first year around. Because just as, I forget who said it earlier, but just because you go into a prelim position or you SOAP doesn't mean you're any lesser of a doctor or not good enough or anything. In fact, the program that I ultimately matched only now they don't have a prelim position anymore, but they used to only interview IMGs for that position so that they gave them a fair chance at matching into the program. I also, my second year applying, a lot of the programs never gave us like feedback or never even told us that you were rejected. So you were just in this in limbo. And I made this massive spreadsheet of all the programs I applied to. And I called all the programs. And some just said, nope, you're rejected. Okay, great, cross them off the list. And some said that I was on their wait list. And so I asked them, can I call you back? And some said, no, you'll hear when you hear. And others said yes. And I remember calling one program and becoming friends with the program coordinator. And I kid you not, 10 years later, I'm still friends with her, and she and I email today. And, and the program that I matched into, I hadn't heard from them. And I called them and I left them a voicemail. And I'd never left a voicemail before because I always wanted to talk to someone. And I called and I said, hey, I applied to this program. I haven't heard back. Just so you know, I'm really interested. The next day they called and gave me an interview. And, I think back to that moment and say, if I hadn't called, if I hadn't left that voicemail, I may not have been here today. And so I'm so grateful that I did that. And I didn't do that my first year applying. And then the other thing I did was I limited where all I applied. My first year, I applied way too broadly. I was privileged enough that, I had parents that could support me in applying really widely. But the second year, I went through and did a more detailed search of where their residents were from. If a program didn't have IMGs or hadn't had IMGs in their alumni, I didn't apply there. I was not going to be the first one that they choose. As much as I might like to believe that would happen, that was not going to happen. So a program that had no IMGs or had never sponsored a visa, I didn't go there. Those programs may not have the resources to be able to support people on visas because they've never done it before. And so narrowing your search to figure out exactly which program you actually have a chance of matching into. Resources I used my second year applying, I joined the AMA because I was ECFMG certified at that point. I couldn't my first year because as an IMG, I had to be ECFMG certified. I wasn't able to make it to a meeting, but I wish I had been able to make it because once I became a resident, I think my second year is when I made it over and I was like, wow, I'd been missing all of this, and I was able to network and meet people. And the other resources, the thing I wish I wish someone would tell me what I did wrong the first time, aside from the prelim thing, because some of the programs that I got interviews at my first and second year actually overlapped. I got interviews at the same program and I matched my one year and I didn't match the other year. So some of those things I'll never know, but those are the things I used and I think made it better.
And I swear I did not pay Dr. Malhotra to say that one of the best things she did was join the AMA, but I'm glad you said it. Dr. Wahlberg, what about you? What would you do differently? Resources?
Sure. So I touched a little bit on my initial talk earlier, is that I wish I had applied more broadly, and the Air Force even informs you to apply to civilian programs prior to the military match in case that doesn't happen. So have backup plans and option. I know that, right? So I guess earlier I talked about possibly receiving calls today. It looks like calls do not start till tomorrow at 8 a.m. Eastern time, if that's correct. And so I was incorrect on that, so I apologize. But I believe my year was, the call started that afternoon. So get your personal statements together, get your letters together. What I use resource-wise is my family was a big help, and after when I had the SOAP, providing emotional support. My girlfriend at the time provided a lot of emotional support for me and helped me filter through the programs to pick out which ones to apply for. In terms of location, in terms of program qualities. I know Daniel mentioned Reddit, and to anyone that's going through the SOAP process, I highly recommend that you look at the Reddit SOAP thread under r/medical school. So the subreddit, medical school subreddit, actually every year has a dedicated SOAP thread for people who've gone through this process. I participated in the 2020 and 2021 SOAP threads for receiving help in the 2020 SOAP thread and providing help in the 2021 SOAP thread. And there are a lot of medical students and some residents and even some programs that are helping edit personal statements, looking over different things like that to prepare for tomorrow. I wanted to echo what a lot of the program directors stated is having the emotion, acknowledging that emotion, but being ready for that interview tomorrow and putting your best foot forward. I think that's going to be crucial. I know someone asked earlier in the chat about red flags. I had a red flag in my application. I had a disciplinary issue during my third year where I was late to one of my rotations, and I got disciplinary probation for that, and I had to apply with that. What I did with that, and I think ultimately did help me, is I was very upfront with that information to the program directors, and whenever I talked about it with the program directors, I always said what I did to improve on that and how I've demonstrated that there's not been any recurrence since then. And I think that that was a key issue or key way that I was able to help myself going forward. And so talk to your family, talk to your friends, talk to your other medical school classmates. A lot of your med school classmates will reach out. And if you have a site, if you have therapy available to you, don't be afraid to use it, but do be careful when calls are coming tomorrow, because they can happen at any time, and you have to be ready at a moment's notice to interview. So I do wish all of you best of luck going forward in the process.
Thank you again for that brutal honesty about the disciplinary action. You know, you didn't have to share that with us, but you did. But again, this is an example to show you that, you know, it's not insurmountable. You know, you can still succeed. You just have to be able to address it, which you did. So that's great advice. Dr. Lee, you had your hand up, but now it's down. So I'm confused.
Oh no, I wanted to add on to that. I think Aaron hit the nail on the head there. When you're going in tomorrow and interviewing, everyone knows you soaped at that point. There's no reason to dance around that. And I'm not going to speak for the program directors in the room, but I think that that people really appreciate that honesty and that acknowledgement. And if you can reflect on why you had those difficulties matching and communicate that in your interviews, I think it really goes a long way to showing resilience and adaptability. And I think that's what everyone's looking for in a physician.
Definitely. Dr. Sorosi, your hand is up. Go ahead.
Yeah, I was just going to react to that. I can tell you that if I call you tomorrow, the first thing I'm going to do is I'm going to tell you how sorry I am that you find yourself in the SOAP and that, things are. And then the second question I'm going to ask you is, so what do you think happened? Why do you think you didn't match in the specialty that you applied in? And if you can't give me a well thought out answer, it's going to be a pretty short phone call, right? If you're like, I have no idea, everybody says it's just weird, right? I think, you know, you just have, just be honest. And I think to the red flag thing, take it on in your personal statement. If you have a red flag, address it in your personal statement, tell your side of the story, because otherwise I'm going to imagine my side of the story and it's going to look a lot less positive than your side of the story.
That is awesome advice. Dr. Edgy.
Yeah, I totally agree. I think you have to anticipate some of the questions that they may ask. And unlike the original match, they can ask some very specific questions. So why do you think you didn't match? What do you consider yourself being weak in that can, you know, contributed to you not matching? What do you hope to do with your career in this specialty? I mean, these are questions that are trying to get at the root of your authenticity. If you don't match through the SOAP, what do you think you're going to do next? I mean, these types of questions are things that you should not be surprised about. And I can certainly send a link of some of the types of questions to Maureen. She can get those out to everybody. But have some thought, be thoughtful, be genuine and authentic about these things. And I would actually recommend practicing with somebody. It's not beneath you to practice. Just set some time aside, have somebody Zoom link you in, and have them right off the top start off with interview questions. No, hi, how you doing? Just get straight to it.
That is wonderful advice. And, you know, don't have somebody who really, really loves you, like your mom, be the person you practice with, because your mom is going to be like, you are perfect. Grab a classmate, grab an advisor, grab somebody you can actually trust, because, you know, your mom's going to think you're terrific and that's not going to help you. Our last question or set of questions go to the program directors. The order that we're going to go is going to be Dr. Andrews, Dr. Edgy, then Dr. Sarosi. We're going to end with you, and then we'll go to Q&A. If SOAP is unsuccessful, what is your advice for our attendees on handling their emotions while their colleagues on Friday are going to be super excited and celebrating and happy, and then they will have feelings of hopelessness, frustration, and disappointment? What do you recommend they do for self-care? You know, should they even be on social media on Friday? That sort of thing. I see. Yeah, I see. Dr. Lee is like, no, don't do it. And what can they do to get ready for next year's match season? If you could end with some encouragement before we go into Q&A.
Yeah, I may not be a good source of advice for this because I don't think anybody should be on social media. So, I mean, certainly not on Friday, but like in general, it's just toxic and I would avoid it. I would hearken back to something Lou said earlier. One of her P's was to plan. And I think part of the plan has to be what happens if this doesn't work out this week? Because, you know, depending on where you're coming from, it's at least as likely that it won't work out as it will. And I think you have to be prepared for that. So that has to be a realistic possibility. You don't want to give yourself the same sense of shock that perhaps you experienced today if at the end of the week you haven't matched. I think that it's probably healthy in some way to own it. I don't think locking yourself in a closet and hoping nobody figures out that you didn't match is the right way to deal with it. I think dealing with it openly and in some positive way to the degree that you're able is important. And I think a part of that plan also has to be, if this doesn't work out, what am I going to do? You know, some schools, for example, will allow you to graduate a year later. They'll keep you on the roll and allow you to graduate and be in a more competitive applicant group as a result for the ensuing year's match. There are some people who one of the reasons they didn't match in the first place may have been they conveyed some ambivalence about a career in medicine. And if that's true, maybe you do start to think about where other arenas in which you might apply your skills in a different employment. So I think a part of what you need to do is to consider the possibility that SOAP doesn't work out, and also have as a part of your plan what you think your own personal next steps might be in the face of that.
Dr. Edgy, your advice for self-care and how to handle everything on Friday if they don't match during the SOAP.
So back to having another earthquake sort of happen in your life again. So back to the 3 Ps. You really want to go ahead and protect your heart. Again, remember that your self-worth did not change from the beginning of the week to the end. It didn't, even though it feels horrific and it feels like it did. I would actually go ahead and jot down every single thing that you have done that has been successful through your life. Just take time to do that, to enjoy the things that are very positive about you. It may seem tedious, but go ahead and do that. Pivot. Again, you're going to have all this emotional energy. You're in a different phase now. Matches behind you. The next step is the next year or whatever it is. And you want to go ahead and completely pivot, put that behind you and move forward. And so that's going to require planning, as John had mentioned. And that is making sure you've got the people in place who can help you with that planning. Make sure you have a good timeline. And the point is to move forward in a way that will help your career move forward. And so, you want to make sure when you look back, that gap year actually was something that you can really speak proudly of, that will elevate who you are as a person and what your application looks like to people receiving you down the line. No social media. I would stay away from social media, but I am a Twitter fiend. I think it's a really important piece of personal networking and everything else. Friday's not the time to be on Twitter. And that's coming from Lou, who tweets all the time.
Dr. Sorosi.
Yeah, I think one of the things that you should do, so even if you don't successfully SOAP on Friday, all of your classmates, all these people that you've spent 4 years with are in a big moment. And actually a big part of resilience is social connection. And so don't hide from them, go celebrate with them. It isn't your joy, but you will gain something from their joy. And I would just encourage you to be out there, and yeah, it'll be awkward, but you're so proud of your friends, and go support them, because it'll actually make you feel better. It really will. It's going to make you feel better, and you can't change anything. Like sitting in a dark room on Friday because things didn't work out, it's not going to make you feel better. I think going and hanging out with your friends is going to make you feel better. I think you really do have to then create a plan, and I think it's pivot and plan. I would say, if you want to stay in for a 5th year of medical school, that's fine, as long as they don't make you pay tuition. That would be my one piece of advice. Otherwise, just graduate and get a job where they pay you, because paying like $25,000 or $30,000 for a year that everybody knows is a 5th year of medical school because you probably didn't match. Because whenever you extend medical school, program directors are going to dig into it because they want to understand why you did it, because it's a deviance from what everybody else does, and so they're going to dig into it. And again, if you don't have a compelling narrative, they're going to assume the worst, right? And that because that's what program directors do. That's the program director mindset. How could this person hurt me, right? And it sounds paranoid and it's awful, but there are stories that are paranoid and awful. And if you have that experience once, you're just once burned, twice shy. And so have a plan. And if research is your deficit, go get a research job. If you need more clinical experience or more clinical connections, try and figure out how to do that. Networking is really valuable. I think if you're going to do research, consider doing research with a chairman or a program director, right? Someone who's going to be personally bonded with you, who can deliver the goods. Doing research with an assistant professor is not going to help you that much, right? Because they can't deliver the goods. If you work for a chair of a department and they love you, they're going to find a way to help you out, right? Because they have. So consider who you network with. And then I have a colleague who is a chairperson of a major department of surgery, who started their career as a preliminary surgery resident. And this person has had an amazing career. So just because the first year doesn't work doesn't mean that you're not going to be amazingly successful, even in your chosen career. And so don't give up. That would be my advice.
That really is the best advice. Don't give up, believe in yourself, take care of yourself, and yeah, party with your classmates. I mean, they'll probably buy you dinner and drinks. So this is the time to do it. And yeah, you'll probably still be a little sad, but I love that advice to just go and do it. Do doctors Lee, Malhotra, or Walbrook have anything else to add before we go to the audience questions?
Yeah, Dr. Sorosi hit it on the nail on the head once again, with the celebrating with your friends. we did like a match celebration on Friday, as typical, and everyone opened up their envelopes. I even had my own envelope but I already knew where I was going, so it was kind of anticlimactic for me. But watching, my best friends open up their envelopes and celebrating with them is just such a strong. It was just it was such a great time to be with them. Even though I was kind of in the dumps, it really uplifted me emotionally and set me up for success in the days to come, as I grappled with this new change in my life. And it was just so relieving just to be with them, because they knew what I went through, and so they were supporting me, I was supporting them. It was just, that's your support system, so you can't abandon your support system when the going gets tough. So that I totally agree, you should be celebrating with those people that are close to you.
And for those people who do successfully SOAP, no one else is going to know. Other than your friends who you told that you didn't match, your program, when you go there, none of the residents are going to know. You are on the exact same playing field. So don't feel any different. I know it's a rough getting there, but once you get there, nobody can tell the difference.
Thank you so much. I'm going to now turn it over to my colleagues. So if they could come on camera, Carolyn Carter-Ellis and Shane McGoey. Shane McGoey is the director of the medical student section, and Carolyn manages the international medical graduate section. And I know they're going to handle Q&A. So I'm going to turn it over to them. And then I'll be back at the end to let you guys know. And please don't hop off the meeting. Please stay till the very, very end, because we actually have some resources that we are going to share. I'm actually going to put it in chat. And we have a poll. So in order for us to do better, because I always feel like there's always room for improvement, we need you to participate in the poll. So we're going to do that at the end. We're going to take the next 15 minutes to do Q&A.
Shane, did you have any?
You're on mute.
Okay, while we're waiting,
There we are. Sorry about that.
Shane. Okay, go ahead.
You want me to go ahead?
Yes, sure.
Okay, so this question's for Dr. Sarosi. I applied to a vascular surgery and got 17 interviews. I am looking into applying to the top 2 IR programs because that is similar to what I enjoy. How can I make the best of these interviews if I'm offered interviews?
I mean, I think, you picked that specialty to try and SOAP into because it shares a lot of the characteristics with what you applied in. And so that'll make sense to a program director if you just tell them that, right? It's a different way of approaching sort of the same set of problems. And I think just be honest about it, right? That's why you picked it, and go with it. I suspect you got a lot of interviews, so you were probably one of those unfortunate candidates who was close, but just not quite close enough, or things didn't work out. And so just keep your mind open and be genuine, and tell them why you applied to those programs, right? You have a good reason, right? It's a similar, slightly different discipline, but a lot of similar things. So highlight those.
Thank you, Dr. Sarosi. This next question is open to anybody on the panel. Some programs say that they will be accepting applications for training beginning 2024 to 2025, but not accepting for 2023 to 2024. What does that mean? In case I accept that offer, do I have to wait another year? Anybody would like to take that?
Those are advanced match programs, right? So there are programs that will be in the SOAP that are filling PGY2 spots for a year from now, not for this academic year, but for the next academic year. And so that's typically what that means, because the match, you can't take an entry position and defer it, right? So that's a program where that's like a PGY2 spot in all likelihood.
Thank you. This next question, go ahead, Carolyn.
Okay, yes, Shane, I have a question that's been posed at least 4 or 5 times. And it reads, should we use all 45 applications up front for the first round or save a few? And anyone can answer that one.
Yeah.
Hi. Sorry. So I answered one of the questions on the chat in case I didn't have internet. I personally used 40 of my applications on the first day, and then I used 5 in the second day. I got was off of the second day of applications from a smaller program that I wouldn't have considered in the first day. And so in that sense, I was grateful, but I know that others used all 45 in the first day and attempt to try to match in a program that way.
Thank you.
Yeah, I was given advice from my school and my mentors to use all 45 applications up front because as some of the program directors have said, the first wave of offers is usually the largest. And so your best shot is applying at those programs and casting the net as wide as possible because the spots drop off dramatically in the second and third wave. So I just threw all 45 out. There's only like 10 neurology programs, and I just threw 35 at medicine.
Thank you. Shane?
Okay, this is a three-part question. I have a brother from India who will apply this year. And the first question is, getting letters of recommendation is important, but how much importance does it serve in the application?
I think that when you think about letters of recommendation, I think you have to think about two things, right? So how well does the letter writer know you is important, but really the most important thing is how well are the people who read the letters going to know the letter writer? And let me just provide you an example, right? A brand new assistant professor who's in their first year as a faculty says, this is the best medical student I've ever worked with. It might be the only one, right? Someone who's been doing this for 25 years who said, this is in the top 10% of the people I've worked with. That's a much more powerful letter of recommendation. And letter writers have histories. I mean, I can speak for my own field. There are some very famous people who every letter they write, they're like, this is an A+ student. And those letters are worthless. And then there are other people who are like, this is a pretty good student, but a not perfect student. But if someone that I know has a record of honesty, those letters are way more valuable. And so trying to get mentors to help you figure out who those people are, those are the people you want to write your letters. If you're applying from India, I would say one thing that'd be really important, don't assume because somebody's famous in another country that program directors in America know who they are. And so I think as painful as it is, you probably want to get as many letters as you can from people in the US who are more likely to be known by the people who are reading your letters.
And I think when
Thank you.
you ask for a letter, make sure you ask them for a strong letter. If they have any hesitancy about whether they're going to write a strong letter, do not ask them, because I've read some really horrible letters which really should not have been written.
Yeah, I would second that, Lou. I smile because I've seen letters and applications and have been puzzled by how the letter actually made it into the application, because it said things about the applicant that if the applicant knew they were being said, they wouldn't have wanted it. I think you can't see the letter in advance. The letters are meant to be confidential, but I think you can ask whether someone would be comfortable writing a strong letter of recommendation. I think that's important.
Thank you, everyone. The second part of that question, does research publication, how important is research publication when applying for internal medicine?
I think that's a matter of the program to which you're applying. There are, internal medicine is a huge discipline, and there are programs that will place a heavy emphasis on research because they prioritize that and are trying to train the next generation of academic leaders. But there are at least an equal number of programs that are trying to train people to provide care to the patients in their local community, and in some cases, the communities around that. And they may have different priorities. They may actually be turned off by a research background because they have experience in the past of people who have a real research bent, but aren't focused on the clinical care that the program really prioritizes. So I think there's no simple answer to that question. It's more about goodness of fit.
Yeah, and also it depends on where you are. If you're like number 2, 3, 4, 5 in that author order, we know that you've just been putting the name in, so you can beef up your application, as opposed to being the first author on something. Being consistent about the topics on which you're publishing shows this is something that you're interested in. This is your expertise. This is what you know about. And then if you're applying to an academic program with all of those research interests and publications, it demonstrates, stick-to-itiveness, and that you've done research and you can publish in that field. But if it's not that, and you're just trying to make your CV look better, people can notice it.
Thank you. And the final the final part of this question, I'm going to try and ask this as I interpret the question. If one has completed step 1 and step 2 with scores, and it's enough to apply, is that okay, or should they continue and also finish step 3?
I'd answered
I
that
think
earlier.
Tani talked about that earlier, didn't you, Tani?
Yeah,
My
I answered that
apologies.
earlier, that to me, as an applicant, I think that if I've already done the exam, then as a program director that's looking at me, I'm a low risk person. I passed the exam. I have shown repeatedly that I am capable of passing exams. And secondly, I don't need to take time off from the program to go take that exam. So I don't think it's necessary. It is not a requirement by any means, but really at the point when you're reapplying for, after having not matched, doing everything possible that could help you is what I would recommend. Just also wanted to go back to that first question, Shane, about the letters of recommendation. And, if the program directors on the panel want to like tell me differently, I will say, coming in as an IMG, there is a known bias against IMGs. It is well documented, it is well known. So when you have because your programs are not the program you're coming from may not be well known to the program directors that are looking at those applicants. So if you're coming from the best school in every country, you're probably okay. But if it's from any other school that they've not previously matched people from, they don't know what they're getting themselves into. Additionally, there are cultural differences between countries, whichever country that may be. And so understand some of those US letters of recommendation, not just are they name recognition, but they also provide a sense of, are you able to accommodate and adjust and culturize? Are you cultured to the US culture, and are you able to fit in and work within the system as it is here? Because and I'm not saying that you shouldn't be here if you don't understand the culture, but those are additional things that you have to overcome as an IMG.
Thank you. Sorry for asking that repetitively, Tani. All right. Carolyn, do you want to ask the next question?
Yeah, I'll ask the last question. What should I do if I receive a phone call from a program while I'm in the middle of an interview with another program?
Yeah. Easiest thing to do, so you don't worry about that one. They'll leave you a message, and you can just call them back right after you finish your interview. No need to be rude to the other interviewer. Just ignore that phone call for now. They will understand that you are likely busy interviewing with another program. They're not going to take any offense to you not answering the phone call the first time, and if they do, that's a red flag.
Okay. Anybody else want to say anything? That's sufficient. Okay, one more question. Would you please show an example of showing resilience and excitement? And then that will end with that one.
I think if you can pick examples in your life about resilience, so I think one of the things that's hard, so I think increasingly in medicine, and when people apply, failure is bad, right? But people often it's hard to get into medical school now if you've ever had a failure, right? It's become that way. But the truth is, we all get better from failing. I fail, hopefully, forward almost every day at work, right? I would love to tell you that I never make mistakes, but that would be not true. And so providing someone an example where you had a bad outcome and you were able to bounce back and gain something from it, I think, and think about something that you can do to provide an example of that. And if it's a compelling story, it's a compelling story.
So I know that one of the questions that people kept asking was, what did you use to look at for criteria for which programs to apply to? So part of it was location, part of it was location, the programs. So for me, I was only able to apply to transitional year programs. So I know that others are going to have a variability on what types of programs that they can apply to. So looking at match trends for that specialty, like Tani was saying, so like if they've never matched a DO, which I'm a DO, then the odds of matching into that program through the SOAP as their very first DO are probably pretty low. And so I would not use an application for that program. And so I think there's also a similar hierarchy as well, as that if a program is, say, a top tier institution, like say for whatever reason Massachusetts General is in the SOAP process, which I don't know why they would be, but and then you have a small community program in Hattiesburg, Mississippi, I think that you're less likely to still get that spot from Massachusetts General, and that if you're I guess try to match yourself as a candidate realistically of the level of program that you're trying to get to. That's what I'm trying to say.
Great advice.
Okay.
Awesome. Well, we are going to bring our program to a close. Thank you, Shane and Carolyn, for handling that. Really appreciate it. Join me, please, in a virtual standing ovation for our wonderful panelists who could have been somewhere else tonight, but they decided they wanted to be with you. They wanted to be helpful, encouraging, practical, and they wanted to give you a little tough love. And I think they get an A+ for that, because I think they checked off all of those boxes. So good luck this week. I really, really hope that you guys navigate through the process, and just keep in mind, if you don't go through SOAP and match, it's okay. It is 100% okay. You're going to pick yourself up. You're going to have a plan, and our AMA is here to help you. So contact us if you need to, and everybody have a good evening.